patellofemoral pain syndrome is a condition that can affect both the young and the elderly, and its diagnosis and its treatment are both challenging to clinicians the world over. Here are 10 things you should know about the patellofemoral pain syndrome. Number 1. The patellofemoral pain syndrome is the most common cause of knee pain in patients who visit doctors' offices and are seen in sports clinics. And in people who run, patellofemoral pain syndrome is diagnosed in a quarter of all of their injuries. Number 2, the patellofemoral pain syndrome is multifactorial. It may result from several abnormalities in the lower extremity or trunk. Clinicians recognize that the patellofemoral pain syndrome may not be a single entity, but several conditions producing the same symptom, that is, pain in the front of the knee. Number 3, the patellofemoral pain syndrome is most common in younger people who engage in running, jumping, and pivotal sports, but it can also occur in elderly patients with age-related changes in the knee. Number 4, the patellofemoral pain syndrome causes gradual onset pain in the front of the knee, below and around the kneecap or the patella. The pain occurs while performing tasks that load the patellofemoral joint while the knee is bent, such as squatting, climbing or descending stairs, jogging, or running. Patients occasionally report buckling of the knees and feeling a popping in the knees, or feeling pain and stiffness after sitting for long periods of time with the knee bent. This is what we call the theater sign. Researchers are still not sure what exactly causes the pain in the patellofemoral pain syndrome. Number 5, the patellofemoral pain syndrome is more common in women than men. Researchers believe that one of the reasons for this is the wide Q or quadriceps angle in women. The Q angle is a measure of the tendency of the patella or kneecap to move sideways when the thigh muscle contracts. The angle is formed by drawing a line from the front of the hip to the middle of the kneecap, and another line from the middle of the kneecap to the lateral border, known as a tuberosity of the shin or tibia. The wider the angle, the greater the force pulling the kneecap sideways, which is believed to cause injury in the patellofemoral joint and induce pain. Some researchers question the importance of the Q angle in patellofemoral pain syndrome. Number 6, there are multiple risk factors for patellofemoral pain syndrome, including anatomic anomalies such as malformation of the patella on the surface that causes friction, or a high-riding patella known as patella alta. There may be malalignment and altered biomechanics of the lower limb. Muscular dysfunction, thigh muscle weakness can lead to muscular dysfunction, or the muscle may contract inappropriately, and that may alter the biomechanics of the lower extremity and lead to friction in the patellofemoral joint. A loose kneecap can cause the kneecap to not ride appropriately in the groove on the surface of the thigh bone, or poor flexibility of the thigh muscle. Here we see the thigh muscle. We have the vastus lateralis and we have the vastus medialis obliquus. Those are the two vasti of the quadriceps or thigh muscle, and if these are not flexible, they can affect the functioning of the patella and cause friction between the patella and the femur, leading to pain. A hamstring behind the thigh may, if there is poor flexibility of the hamstring, that can affect the functioning of the patellofemoral joint. the iliotibial band. This is a big one. You can see it right here, iliotibial band running down the outside or lateral side of the thigh, and that stabilizes the joint, stabilizes the patella. And if that is not flexible, or if it is tight, it can pull the patella laterally to the side, and it then prevents the patella from running smoothly in the patella groove on the thigh bone or the femur. Tight lateral structures, like I mentioned, for instance, the lateral retinaculum. The lateral retinaculum, you can see it right here, this tendon sheet. And if that is tight, that too, in similar fashion to how I explained with the iliotibial band, it can pull the patella laterally and affect the smooth movement of the patella in the groove on the femur or the thigh bone. Once again, the iliotibial band, if that is tight, that can affect the function of the patella in the knee. Incorrect training or overuse, if athletes overuse their joints, or they increase the stress they place on their joints suddenly and not gradually, then that too can lead to injuries, and it can lead to stress on the joint, leading to patellofemoral pain and patellofemoral syndrome. Worn out or inappropriate footwear in similar fashion can change the biomechanics of the knee and cause patellofemoral pain and patellofemoral pain syndrome. Number 7. Physical examination is the mainstay of diagnosis of the patellofemoral pain syndrome. There is no definitive clinical test for patellofemoral pain syndrome. Because the syndrome has myriad causes, doctors rely on a long list of clinical tests evaluated together to come to a diagnosis. The best way to diagnose the patellofemoral pain syndrome is to induce pain while performing tasks that load the patellofemoral joint while the knee is bent. Of these, the squat test is the most sensitive and most accurate. People who have pain while squatting have an 80% chance of having the patellofemoral pain syndrome. Number 8. Radiological examinations are not needed to diagnose patellofemoral pain syndrome. In fact, the patellofemoral pain syndrome can be considered a diagnosis of exclusion, and doctors mainly use radiological examinations to rule out other diseases rather than to rule in patellofemoral pain syndrome. Occasionally, radiological studies show changes that support a diagnosis of patellofemoral pain syndrome. Number 9. Doctors are experimenting with ultrasound as a diagnostic procedure for patellofemoral pain syndrome. They use ultrasound to measure the characteristics of the inner head of the thigh muscle, known as the vastus medialis obliquus, and the thickness of the tendons that attach to the kneecap or patella. They have found a correlation between the volume of the inner head of the thigh muscle and the likelihood of having patellofemoral pain syndrome. Patients with patellofemoral pain syndrome have increased thigh muscle and patella tendon thickness. They've also found a correlation between difference in the rate of activation of the gluteus medialis muscle on either side and the level of pain in patellofemoral pain syndrome patients. Number 10. The best treatment for patellofemoral pain syndrome is physical therapy. This often involves a patient individualized program strengthening and stretching the thigh and gluteal muscles. Clinicians may attempt to reposition the kneecap and guide it in the groove on the surface of the thigh bone by taping or by applying a brace. Occasionally, they use NSAIDs, anti-inflammatory drugs, to reduce the pain, but the benefit that these provide is limited. Clinicians resort to surgery only if an extensive rehabilitation program fails. So there you have it. 10 things you should know about patellofemoral pain syndrome. Like, share, leave your comments in the section below, and support the channel by subscribing. Every little bit helps. Thank you for watching. I'll see you in the next video.